with test anxiety, the main two priorities is to make sure that you have slept and eaten well, okay? Low blood sugar will make you very anxious. Lack of sleep will cause your brain to not function quite the way it should and induces anxiety. Relaxation and breathing and visualization and progressive muscle relaxation, those are all strategies that we teach our patients, and we just need to teach ourselves too. And very rarely are you going to be so slammed in a test that you can't stop a minute, close your eyes, and take a deep breath. Do you know what progressive relaxation is? Have you heard of that?
No.
Okay. So the idea behind progressive relaxation is, now you might start off with you tense all of your muscles at once. Like you just very focused, tense all your muscles, and then relax them. Now, the progressive part, you're going to back off from that, and then you might start at your toes. And you're going to purposefully tense your toes and purposefully release them. And you work your way up your body, even to the point where you're like tensing your face, and then purposefully relaxing it maybe. I mean, you're trying to pass a test. Do you really care if people are looking at you? Not a bit, right? So that's one exercise that you could try to do especially when deep breathing really is not enough. Because in order to do that, you really have to focus on each one of those muscle groups in order to make it work. So by the time you get from your toes, usually till about the time you get to your upper arms, you're starting to feel pretty chill, okay? And then you can start again.